Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about the main cause of why people have achy, tired feet at the end of the day. Now there's lots of things that can cause foot fatigue and achiness, but one of the primary causes is simply having a foot structure that is basically on the flat side. Now a lot of people who have achy and tired feet are going to say, well, my foot's not flat, I can see a good arch when I look at it. Well, the fact of the matter is that with the exception of people who have very rigid flat feet because of abnormal bone structure, most people who have feet that are on the flatter tendency aren't going to necessarily notice that until they stand up and load pressure onto the foot. And even then it's really hard to kind of look at your own feet to be able to tell. Flat feet are basically a genetic variation of foot structure, and many people have this. But what occurs is that over time, the flatness of the foot combined with the use of shoes from an early age as well as other factors sort of contribute to an overall instability of the foot and a lack of sort of muscle control and a lack of strengthening of some of the ligament structures. Over time, this can be seen as sort of an achiness in the foot as one stands for a long period of time or has a busy active day. And what's technically happening is that some of the ligament structures on the bottom of the foot, which also include a large band of tissue called the plantar fascia, as well as a tendon that can go on the that runs on the inner side of the foot that helps to stabilize the foot, something called the posterior tibial tendon. All those can become irritated and fatigued by the flattening motion of the foot over the course of a long day or an active day. And so as these structures become fatigued, the foot can feel tired, it can feel achy. In some cases, damage can actually occur to some of these tissues, and you can develop conditions like plantar fasciitis, which is inflammation of the plantar fascia, or tendinitis of the posterior tibial tendon, or other types of strain and syndromes associated with that. Over time, if the flattening is significant enough and the strain is significant enough. But many people don't have this, and they just simply have tired, irritated feet because the tissues are just getting fatigued. One of the easiest ways to tell if this is your problem and tell how you can necessarily fix it is to simply go and make sure that you're wearing a good supportive shoe, particularly an athletic shoe with a good stiff sole that bends basically where the toes bend but doesn't bend right in the middle of the shoe. And also using a good commercial grade insert inside the shoe, arch support. Now, stuff that's usually commercially available in a lot of the pharmacies is usually too flexible because they're made out of foam or some other type of material that compresses as soon as you step on it. So if you can find a product that has a little bit more resiliency to it, such as some form of a flexible plastic plating inside the insert, that's going to hold up a little better from the standpoint of an over-the-counter insert. Our office happens to use Power Step inserts, which work really well for our patients as a good over-the-counter solution. But there are others out there that are relatively similar. So by using a good supportive shoe and using a supportive insert, if there's a simple improvement in the way that the feet feel from an achiness perspective, then that means that much of this is related to having a little bit of a flatter foot structure and you need more support. Now, sometimes just simply wearing supportive shoes and using an over-the-counter insert is good enough, and that can relieve a lot of the issue. However, in some individuals, we have to go a little bit further, another step forward rather, and utilize prescription orthotic for more long-term control of the foot structure. Well, I hope you enjoyed this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may check my website at www.inpodiatrygroup.com. Thank you.